Hello, hello, hello. It's Dr. Ruby. Uh-oh, blocked my camera. My bad. What's up, y'all? It's been a minute since I've been live. Hopefully you can hear me okay. I'm still here though. I'm still kicking, still working. Wanted to come on. I had a few announcements. One really big one actually is that I am now officially a double boarded physician. So I'm board certified in pediatrics, have been for about 5 years, and now I am also board certified in public health and preventive medicine. So most physicians only have a single board exam under their belt, but I'm double certified. And so I love pediatrics, I love children, but prevention has really been my passion for a long time. I've always been more interested in how we keep people from getting sick, how we keep people healthy, than how we make them better after they get sick. So that was why I sought certification in preventive medicine and public health, which is focused on keeping communities healthy, health behaviors and nutrition and measures that you can do in the public and community to make sure all people stay healthy versus just how you clinically see people in a hospital and treat them, hey Tafari, and treat them after they get ill. So that journey in preventive medicine sort of led me to the field of health coaching, which is a lot of what I do now. So for those of you who don't know, a health coach is someone who facilitates healthy, sustainable behavior change by challenging you to listen to your inner wisdom, identify your goals, and transfer those goals into action, which is something that is really powerful to do and something that is really innate for a lot of people to do on their own. But this has been a growing field in medicine for a little while now. And like I said, I sort of got into it through my preventive medicine training. But it's sort of different from what I do as a doctor. So as a doctor, as a physician, you diagnose usually illness, you prescribe. So you're basically just telling people what they should and should not be doing, what they should and should not be taking, what medicines to take, etc. And there's a role for that sometimes, like if you're acutely ill, if you're really sick and you need an answer, yeah, you go to the ER, you go to the doctor. If you have an infection, you want antibiotics and you want to get better. If you have, if you get in a car accident, you need surgery, you need somebody who can do that quickly and know what decisions make to get better. But there's a real paradigm shift in medicine going on these days in that patients are more empowered and there's a lot of information out there. So a lot of people are doing their own research, looking for their own solutions. And we're in a phase of healthcare where chronic diseases are causing a lot more problems than infectious diseases. So if you look at the history of medicine, years and years ago, mostly before sanitation became a big thing in this country, the biggest problems were infectious diseases. Like women would not go to the hospital to have babies because the doctors didn't know about hand washing. So women who went to the hospital to have babies would die in childbirth more often than the women who did it. And that was found to be due to the lack of hand washing over time and the bacteria and things that got passed along because of that. But, we got antibiotics, sanitation came along. We've been able to pretty much deal with infectious diseases pretty well in this country as a system. What's killing us is the things like diabetes, heart disease, high blood pressure, cancer. And many of these are directly related to nothing more than what you eat and how much you move and how you manage your stress. If you haven't heard, processed meat has been classified as a carcinogen, which is a cancer-causing agent by the International Agency of Research on Cancer. Red meat has been classified as a probable carcinogen, so a probable cancer-causing agent. And so we can link this stuff and, smoked meat which has nitrates in it, has been linked to stomach cancer for a really, really long time. So this isn't new news. You know, what you eat, if you eat a lot of processed foods, if you eat a lot of sugar, if you don't move, this can lead to chronic diseases like diabetes. And these diseases are what cost the healthcare system a lot of money because they're chronic, meaning you have to treat them for a long time and they don't necessarily get better in the traditional medical system. So part of why I learned about health coaching and decided to get more into it was due to a lot of the constraints I had as a physician. Time is a big issue if you're working in traditional medical practice, really getting to see a patient, talk to them, and really figure out what's going on in their life that's impacting them and impacting their health behaviors. Patient interest, a lot of the patients that you see day to day in clinic, you know, you can talk to your blue in the face about their nutrition and exercise. If that's not really what they came in for, they don't really want to hear it. There are a few people who tend to be interested, but that's not the majority. So that can be kind of frustrating as a physician who's interested in this stuff. Over time, you know, just not getting any response. So that's why I, you know, did some training in health coaching and really shifted my career toward educating people and then empowering people to help find their own solutions to their health problems. So I'm unique in that as a physician, I understand the pathology of diseases, what causes them. I understand the medical side of it, what medications you should be on, why your doctor may be doing the things that they're doing the way they're doing. And this is not public service announcement. You should listen to your doctor and do what they tell you to do until you're at a point where you can stop. So, for example, if you have diabetes and your blood sugars are 300, 400, yes, you need to be on insulin and medication until you can get your diet to the point where your blood sugars can naturally be low and you can gradually come off of it. I'm not encouraging anybody to stop going to their doctor, stop listening to their doctor. You should definitely have a primary care doctor, somebody who you see on a regular basis, who knows you and who follows you over time, right? But what I can help with is help you understand those health behaviors and sort of those little bitty details and changes that you may need to make to really help improve your health. For example, I was working with a young lady a little while ago, and she had been doing really well. She was pretty much all plant-based, no oil. You know, she was a rock star, but she had this like one tiny little issue. She's like, I can't get rid of tortilla chips. Like, I just love tortilla chips. I love Mexican food. And that's like the only thing I buy with oil in it that's at the store. And so over time in our health coaching relationship, we got to talking, and she would make them herself on a regular basis, but she would just run out of it because her family ate it a lot. So through that conversation, we came to a really simple solution. I was like, why don't you just pre-make a batch of it for the week? And you'll have it. And it was like a light bulb. So she was like, oh my gosh, I never thought about that. That was so easy for me to do. And I've been struggling with it for months and months and months. So that's the type of thing working with a health coach can help you do. It can help you look at the things you're already doing and adjust those behaviors accordingly. And it's focused on you. So it's not the coach telling you, like the doctor would be, you need to take this medicine, you need to do this, you need to do that. It's the coach exploring with you what your motivations are, what your habits are, and how can we adjust those so you reach the health outcome you want to reach, whether that's losing weight, getting off your medicines, just eating better, getting exercise more. So that's sort of the difference between what I do as a doctor and what I do as a health coach, which is what I love to do, is really help people come to their own conclusions about how to change their health behaviors. So having said that, I'm doing something I haven't done in a while. So I used to do some one-on-one coaching with people, but I sort of put that on the shelf for a while for numerous reasons, but I've taken it off the shelf. I'm back. So I'm opening my calendar for my 6 weeks program. It's called Plant-Based But Not Perfect, which I think speaks to the person who may have already made some serious changes to their health. They may be doing awesome. There may be a rock star already, but they're still struggling with those one or two tiny little things that's really still holding them back in their health journey. And so what I would do is I would work with you to develop some strategies around those struggles and help you pinpoint what those one or two things are so that you can make powerful changes for your health and get to the promised lands. So if that sounds like something that you need, want, desire, or if you just have questions about it, I invite you to hop on my calendar. I'm going to put a link in the comments for a free discovery session. This is just when we hop on the phone for 15 to 30 minutes. We talk about what your goals are, what your needs are, and we talk about how I can help you. So I'm going to drop the link here. I believe that is it. And I have limited spaces on my calendar usually. Y'all know I got two boys who don't sound like they're upstairs killing each other right now, but maybe very soon. So I have limited space. So if this sounds like anything that you need, want, if you just want to hop on the phone and chat with me for a few minutes, I'd be happy to talk with you. And yeah, so that's the difference between health coaching and being a doctor, and why you need a health coach, because sometimes you need an outside pair of eyes to help you look at what you're doing to see where you can make changes. All right, my people, I'm gonna hop off. Let me see if there are any questions in here I can answer real fast. What's up, fam? How cost effective is that for the patient? So I'm glad you asked that question, Mike. So how cost effective is being in the hospital getting your foot amputated because you had diabetes? So a hospital bill is going to be far more than any amount of money you would pay to a health coach. It's quick to rack up a $10,000 hospital bill from, diabetes, cancer, high blood pressure, hypertension with, one ER visit or one overnight hospital visit. It's quick to do. Versus seeing a health coach, they charge varying things, some may charge you for a package for like 12 weeks for like $1,500. But if you compare that to the cost of being sick, it's pennies on the dollar. And, the problem with the healthcare system, I think in this country, is that so much of the money is focused in the sick care system versus the prevention system. So if we targeted more dollars towards making sure our food supply was healthy and accessible for everybody, we wouldn't have to spend so much money treating diabetes in the hospital, treating cancer in the hospital or in the doctor's office. We wouldn't have to spend so much money on producing medications to treat these things if we just spent the money up front and making sure everybody had access to the food they needed, access to the clean spaces they needed for exercise, access to education, and the list goes on and on. But the way our system's set up, what pays the bills is being sick. And like I said, if you have diabetes, let's say you get diagnosed with diabetes in your mid to late 40s, you can live another 20 years just having the disease managed, right? So that's 20 years of doctor visits every 3 months with that copay. That's 20 years of insulin. That's 20 years of medication. You're probably going to have some hospital visits in there. So it's really quick to rack up the debt, from being sick. But you can invest, a couple $100 every 2 weeks to work with a health coach who's going to help you, figure out the behaviors you need to do to get better, to improve your health habits. So the goal of any health coach and any good doctor, I'll say, is to not ever have to see you again. That's what I say. It's like, my favorite patient is the one I never need to see because they're healthy and they don't need me. And that's what any good health coach should be telling you. It's like, I'm here to give you the tools so that you can manage your health and stay healthy without needing me. So I hope that answers your question. Yeah, people aren't valuing their health enough. I mean, if you're unhealthy, like if you're sick, really what can you do? It's hard to work. You have to go on disability, having fun, running around after your kids. It's a struggle. It's not a life that anybody wants to live. But a lot of people end up living it because of, this flawed system we live in. And, we're just at the point now where people need to take responsibility for their own health behaviors as much as they can. And I understand that the system is not perfect. Access can be an issue, but you have to do what you can. You have to look within your communities for what your resources are and maximize those. All right. Let me see if there's any more questions in here. I don't think so. And I'll say this to you, Mike. You got me. So holler at your cousin. All right. All right, y'all. I'm gonna hop off here. Like I said, if you want to chat with me, just make an appointment right here in the link, and we can hop on the phone as soon as tomorrow. All right. I will talk to y'all soon. Peace.